1. The cerebrum is responsible for controlling voluntary muscle movements. True or false? Answer: true. Rationale: the cerebrum, specifically the motor cortex in the frontal lobe, controls voluntary muscle movements by sending signals through the corticospinal tract to motor neurons. This is critical for coordinated movement in clinical settings. 2. The vagus nerve is part of the somatic nervous system. True or false? Answer: false. Rationale: the vagus nerve, cranial nerve X, is part of the autonomic nervous system, primarily regulating parasympathetic functions like heart rate and digestion, not somatic functions like voluntary movement. 3. An action potential is generated when a neuron's membrane potential becomes more negative. True or false? Answer: false. Rationale: an action potential occurs when a neuron's membrane potential depolarizes, becomes less negative due to sodium influx, triggering nerve impulse transmission. This is essential for understanding nerve conduction in neurological assessments. 4. The cerebellum is primarily responsible for maintaining balance and coordination. True or false? Answer: true. Rationale: the cerebellum integrates sensory input to fine-tune motor activities, ensuring balance and coordination. Damage to the cerebellum can lead to ataxia, a key clinical finding in neurological exams. 5. Myelin sheaths slow down nerve impulse transmission in axons. True or false? Answer: false. Rationale: myelin sheaths, produced by Schwann cells and oligodendrocytes, insulate axons and speed up nerve impulse transmission via saltatory conduction, which is critical for efficient neural communication. 6. The sympathetic nervous system decreases heart rate during stress. True or false? Answer: false. Rationale: the sympathetic nervous system increases heart rate during stress by releasing norepinephrine, preparing the body for a fight-or-flight response, a key physiological mechanism in neurological regulation. 7. The blood-brain barrier allows all substances to pass freely into the brain tissue. True or false? Answer: false. Rationale: the blood-brain barrier, formed by tight junctions in cerebral capillaries, selectively restricts substances from entering the brain, protecting it from toxins and pathogens, a vital concept in neurological pharmacology. 8. A reflex arc requires the brain to process sensory input before a response. True or false? Answer: false. Rationale: a reflex arc involves a rapid, involuntary response to a stimulus, processed directly by the spinal cord without brain involvement, as seen in the knee-jerk reflex, important for neurological assessments. 9. Dopamine is a neurotransmitter primarily associated with inhibitory effects in the brain. True or false? Answer: false. Rationale: dopamine can have excitatory or inhibitory effects depending on the receptor, but it is primarily involved in reward, motivation, and motor control, as seen in conditions like Parkinson's disease. 10. The occipital lobe processes visual information from the eyes. True or false? Answer: true. Rationale: the occipital lobe, particularly the primary visual cortex, processes visual input from the retina via the optic nerve, a critical function for interpreting visual stimuli in clinical neurological evaluations. 11. The hypothalamus regulates body temperature and hunger. True or false? Answer: true. Rationale: the hypothalamus controls autonomic functions like body temperature and hunger through its connections with the endocrine and nervous systems, critical for maintaining homeostasis in clinical practice. 12. The peripheral nervous system includes the brain and spinal cord. True or false? Answer: false. Rationale: the peripheral nervous system consists of nerves outside the central nervous system, which includes only the brain and spinal cord, a key distinction for understanding neurological assessments. 13. Sodium ions rush out of a neuron during depolarization. True or false? Answer: false. Rationale: during depolarization, sodium ions rush into the neuron, causing the membrane potential to become less negative, initiating an action potential essential for nerve signaling. 14. The basal ganglia are primarily involved in regulating voluntary motor control. True or false? Answer: true. Rationale: The basal ganglia modulate voluntary movements by inhibiting unwanted motions and facilitating smooth execution, a function disrupted in disorders like Parkinson's disease. 15. The optic nerve carries visual information from the retina to the brain. True or false? Answer: true. Rationale: the optic nerve, cranial nerve 2, transmits visual signals from the retina to the occipital lobe, a critical pathway for assessing visual deficits in neurological exams. 16. A synapse is a physical connection between two neurons. True or false? Answer: false. Rationale: a synapse is a functional junction where neurons communicate via neurotransmitters across a synaptic cleft, not a physical connection, vital for understanding neural transmission. 17. The parasympathetic nervous system promotes the rest and digest response. True or false? Answer: true. Rationale: the parasympathetic nervous system conserves energy by slowing heart rate and promoting digestion, a key mechanism for managing stress-related neurological conditions. 18. The frontal lobe is responsible for processing auditory information. True or false? Answer: false. Rationale: the frontal lobe handles executive functions like decision-making, while auditory processing occurs in the temporal lobe, important for localizing neurological deficits. 19. Acetylcholine is the primary neurotransmitter in the somatic nervous system. True or false? Answer: true. Rationale: acetylcholine is released at neuromuscular junctions in the somatic nervous system to stimulate voluntary muscle contraction, a key concept in neurological motor assessments. 20. The spinal cord ends at the level of the L5 vertebra. True or false? Answer: false. Rationale: the spinal cord typically ends at the L1, L2 vertebral level, conus medullaris, a critical anatomical landmark for procedures like lumbar punctures in neurological care. 21. The thalamus relays sensory information to the cerebral cortex. True or false? Answer: true. Rationale: the thalamus acts as a relay station, directing sensory inputs, except smell, to appropriate cortical areas, essential for sensory processing in neurological evaluations. 22. Increased intracranial pressure always results in immediate loss of consciousness. True or false? Answer: false. Rationale: increased intracranial pressure may cause symptoms like headache or vomiting before loss of consciousness, depending on severity, a key consideration in neurological emergencies. 23. The trigeminal nerve is responsible for facial sensation and chewing. True or false? Answer: true. Rationale: the trigeminal nerve, cranial nerve V, provides sensory innervation to the face and motor control for mastication, critical for assessing facial neurological function. 24. Neurons can regenerate quickly in the central nervous system. True or false? Answer: false. Rationale: central nervous system neurons have limited regenerative capacity due to inhibitory factors, unlike peripheral neurons, impacting recovery in neurological injuries. 25. The limbic system regulates emotions and memory. True or false? Answer: true. Rationale: the limbic system, including the amygdala and hippocampus, modulates emotions and memory formation, key to understanding behavioral changes in neurological disorders. 26. A stroke in the left hemisphere can cause paralysis on the left side of the body. True or false? Answer: false. Rationale: a stroke in the left hemisphere typically causes right-sided paralysis due to the crossing of motor pathways in the medulla, a critical concept for stroke assessment. 27. The medulla oblongata controls voluntary muscle movements. True or false? Answer: false. Rationale: the medulla oblongata regulates involuntary functions like heart rate and breathing, while voluntary movements are controlled by the motor cortex, important for neurological localization. 28. GABA is an excitatory neurotransmitter in the brain. True or false? Answer: false. Rationale: GABA, gamma-aminobutyric acid, is the primary inhibitory neurotransmitter, reducing neuronal excitability, a key target in managing seizures and anxiety disorders. 29. The dura mater is the innermost layer of the meninges. True or false? Answer: false. Rationale: the dura mater is the outermost meningeal layer, followed by the arachnoid and pia mater, a critical distinction for understanding neurological infections like meningitis. 30. The autonomic nervous system controls voluntary muscle movements. True or false? Answer: false. Rationale: the autonomic nervous system regulates involuntary functions like heart rate and digestion, while the somatic nervous system controls voluntary muscles, key for neurological assessments. 31. The corpus callosum connects the two cerebral hemispheres. True or false? Answer: true. Rationale: the corpus callosum facilitates communication between the left and right hemispheres, enabling coordinated cognitive and motor functions, vital in neurological evaluations. 32. Seizures are always accompanied by loss of consciousness. True or false? Answer: false. Rationale: focal seizures may occur without loss of consciousness, unlike generalized seizures, a distinction critical for accurate diagnosis and management in neurological care. 33. The facial nerve controls the sense of taste on the posterior third of the tongue. True or false? Answer: false. Rationale: the facial nerve, cranial nerve 7, controls taste on the anterior two-thirds of the tongue, while the glossopharyngeal nerve handles the posterior third, key for cranial nerve exams. 34. The pons is involved in regulating sleep and arousal. True or false? Answer: true. Rationale: the pons, part of the brainstem, contains the reticular activating system, which modulates sleep and arousal, a critical function in neurological status assessments. 35. Oligodendrocytes produce myelin in the peripheral nervous system. True or false? Answer: false. Rationale: oligodendrocytes myelinate axons in the central nervous system, while Schwann cells myelinate peripheral axons, a key distinction for understanding neurological repair. 36. The primary motor cortex is located in the parietal lobe. True or false? Answer: false. Rationale: the primary motor cortex is in the frontal lobe, controlling voluntary movements, while the parietal lobe processes sensory information, important for neurological localization. 37. The glossopharyngeal nerve is responsible for swallowing. True or false? Answer: true. Rationale: the glossopharyngeal nerve, cranial nerve 9, innervates pharyngeal muscles involved in swallowing, critical for assessing dysphagia in neurological patients. 38. Cerebrospinal fluid is produced in the cerebral cortex. True or false? Answer: false. Rationale: cerebrospinal fluid is produced by the choroid plexus in the brain's ventricles, not the cortex, and cushions the brain, a key concept in neurological diagnostics. 39. The reticular formation regulates posture and balance. True or false? Answer: true. Rationale: the reticular formation in the brainstem coordinates posture and balance by integrating sensory and motor signals, essential for neurological motor assessments. 40. A concussion always results in permanent brain damage. True or false? Answer: false. Rationale: a concussion typically causes temporary neurological dysfunction, with most patients recovering fully, though repeated injuries may lead to long-term effects. 41. The vagus nerve innervates the diaphragm. True or false? Answer: false. Rationale: the vagus nerve, cranial nerve X, innervates visceral organs, while the phrenic nerve controls the diaphragm, a distinction critical for respiratory neurological assessments. 42. The hippocampus is primarily responsible for short-term memory. True or false? Answer: true. Rationale: the hippocampus consolidates short-term memories into long-term storage, a function impaired in conditions like Alzheimer's disease, key for neurological evaluations. 43. The sympathetic nervous system dilates pupils in response to stress. True or false? Answer: true. Rationale: the sympathetic nervous system activates pupil dilation mydriasis during stress to enhance vision, a key autonomic response in neurological exams. 44. The corticospinal tract controls involuntary reflexes. True or false? Answer: false. Rationale: The corticospinal tract governs voluntary motor functions, while reflex arcs manage involuntary reflexes, a distinction vital for neurological motor testing. 45. The amygdala is involved in processing fear and emotional responses. True or false? Answer: true. Rationale: the amygdala, part of the limbic system, modulates fear and emotional responses, critical for understanding behavioral changes in neurological disorders. 46. Multiple sclerosis is caused by overproduction of myelin in the brain. True or false? Answer: false. Rationale: multiple sclerosis results from autoimmune destruction of myelin in the central nervous system, leading to impaired nerve conduction, a key neurological condition. 47. The oculomotor nerve controls lateral eye movement. True or false? Answer: false. Rationale: the oculomotor nerve, cranial nerve 3, controls most eye movements, but lateral movement is governed by the abducens nerve, critical for cranial nerve assessments. 48. The brainstem includes the midbrain, pons, and medulla oblongata. True or false? Answer: true. Rationale: the brainstem comprises the midbrain, pons, and medulla oblongata, regulating vital functions like breathing and heart rate, essential for neurological exams. 49. Neurotransmitters are stored in the axon terminals of neurons. True or false? Answer: true. Rationale: neurotransmitters are stored in vesicles at axon terminals, released into the synaptic cleft to transmit signals, a key mechanism in neurological communication. 50. The temporal lobe is responsible for processing olfactory information. True or false? Answer: true. Rationale: the temporal lobe, particularly the olfactory cortex, processes smell signals from the olfactory bulb, a critical function in neurological sensory assessments.